Then comes the million-dollar question. Now, if a pregnant woman gets diabetes during pregnancy, what should she do? So, the first line of management in such pregnant women is medical nutrition therapy or MNT, or simply we can say that she has to make some dietary changes. So, what we recommend for MNT is that this pregnant woman should take 3 meals, that is breakfast, lunch and dinner, and she should have at least 2 to 3 snacks. Now, one of these snacks should always be bedtime, because what happens is that if you do not take a snack just before you are sleeping, then you can have ketosis in the night, and this is very bad for the neurodevelopment of the baby. So one of the snacks is always recommended to be taken bedtime. And why are we adding these 2 to 3 snacks in a diet is that because if you eat too much during any of the meals, then what happens is it leads to a spike in your blood sugar. That is why you should have moderate portions in your 3 major meals, and you should have 2 to 3 snacks in between. Second important thing is that avoid simple carbohydrates and take more of complex carbohydrates, because if you take simple carbohydrates, they lead to a spike in blood sugar. So now what is the diet which is rich in complex carbohydrates? So this would mean that you include more of oats, then jowar, bajra, whole pulses. You take fruits with their skins. And what do you need to avoid in simple carbohydrates? That is mainly bread, cakes, pastries, Maggi, pasta, all this needs to be avoided. Then second important component of your diet is fats. So saturated fats which are found in ghee, butter or palm oil, they should constitute only 10% of your full energy diet, And so what you need to do is that you need to cut down on oil that you are using during cooking, switch over to toned milk. Then the snacks that you take, avoid fried food or fried snacks. Instead, you snack with fresh fruits, which would be much more beneficial to you. Then you have to keep yourself well hydrated, because this also helps to keep your blood sugar levels in check. And not to forget exercise. You should be doing moderate exercise in the form of, say, walking at least 30 minutes in a day for 5 days a week. So once we have started a woman on medical nutrition therapy, then after 2 weeks of these dietary changes, we do a blood sugar post meal. That is, after she has taken a meal, 2 hours after that, we do a blood sugar level. And if this is less than 120 mg%, that means that she can continue on this diet therapy throughout her pregnancy now. And we repeat a blood sugar post meal every 2 weeks till she is 30 weeks of pregnancy. And after that, we do blood sugar levels every week. Now, suppose her blood sugar level at any point is more than 120 mg%, then it shows that she is not controlled on diet, and now she needs to be switched to insulin therapy. Now, insulin therapy is the mainstay of treatment in diabetes during pregnancy, because this is one drug which does not cross the placenta. So it is absolutely safe to be given to pregnant women. So now, how do we decide what dose to start insulin in? As a rule of thumb, the total dose of insulin which is to be given to a woman during a day during pregnancy would depend on the weight of the woman as well as her period of gestation. So if the pregnancy of the woman is less than 13 weeks, then the total dose of insulin would be the weight of women in kilograms multiplied by 0.7. Between 14 weeks to 26 weeks, this would be weight of the women multiplied by 0.8. Between 27 to 37 weeks, this is weight into 0.9. And after 37 weeks, the total dose of insulin is weight of the women into 1. So this is the total dose of insulin which is generally required. But once we start the insulin, Generally, we start with mixed insulin 30/70, which is given subcutaneous before breakfast. And after 3 days of starting this insulin, we do a blood sugar fasting as well as a blood sugar postprandial, that is 2 hours after meals, to see whether her sugar is controlled or not. And again, postprandial, her blood sugar should be less than 120 milligram percent, and fasting should be less than 95 milligram percent. Now, in case her insulin, with the dose that you have started, these levels are not reached, then you would adjust the dose of insulin accordingly. So you really don't need to worry about that. What you need to understand is that you should be going to your gynecologist regularly when you are on insulin, so that she can adjust your dose according to your blood sugar levels. There are some oral anti-diabetic drugs which can be used, but they are generally not preferred. One is tab metformin, which is started in the dose of 500 milligram once a day, and it can be increased if the blood sugar levels are not controlled. The maximum dose of metformin which can be used is between 2500 to 3000 milligram. The main side effect which is seen with metformin is abdominal pain and diarrhea in the mother, as well as it can even lead to premature births. And it's been seen that almost 50% of women who are on metformin would also require injection insulin. The second oral drug which can be used during pregnancy is tablet glyburide. It is started in the dose of 2.5 milligram once a day, and the maximum dose is about 20 milligram. But the recent studies have shown that using glyburide during pregnancy can lead to hypoglycemia in the baby, as well as the incidence of respiratory distress syndrome and admissions to neonatal ICU have also been increased with its use. So these drugs are generally not advocated during pregnancy, and injection insulin is the mainstay of treatment of diabetes which develops during pregnancy. Now, another important question is that once this woman who has got diabetes during pregnancy has delivered, what is to be done after that? Does she need to be followed up after delivery? So the answer to this question is a definite yes. Once a woman with diabetes has delivered, then we repeat a blood sugar fasting as well as postprandial on day 3 of delivery. And if this is normal, then we repeat a OGTT with 75 grams glucose anywhere between 6 to 12 weeks after delivery. If her blood sugar level is less than 140, that means that she has not developed diabetes yet. If the level is between 140 to 199 milligram percent, then we call this as impaired glucose tolerance. And if her blood sugar is more than 200 milligram percent, then she is a case of diabetes mellitus. Now, if her blood sugar was less than 140, that means that the screen was negative, then this woman has to undergo a OGTT with 75 grams of glucose every 1 to 3 years lifelong, because anywhere between 10-15 years there is a high chance that she will become diabetic, and it is very important to pick that up timely. So if your blood sugar is high during pregnancy, don't panic, don't be alarmed, don't be worried too much. It just means that you need to have regular follow-up with your gynec so that your blood sugar levels can be kept in control. So be aware and be safe.